Welcome to Health Cities Talks community. I'm Stephanie Gillis-Paulgaard, founder and chief strategist of Take Roots Consulting, and I'm joined by Murray Soroka, co-founder and CEO of Jasper Place Wellness Centre. Welcome, Murray. Thank you for being here.
Great to be here, Stephanie.
Well, before we kick it off, I thought we might give you an opportunity to provide a bit of a background on Jasper Place Wellness Centre for those that may not be familiar. Maybe walk us through how it got started, who you serve, and what the goals of the organization are.
Sure. The Jasper Place Wellness Centre was formed in 2006 through community engagement. A group of us in the community felt that there was a need to do more in our community, and we got together and decided to engage the community and ask the community members what was necessary, what was needed, what was missing in our community. And out of those conversations and those engagements, we found that people were really wanting to engage in housing in a different way. There was not enough housing for people in poverty and people experiencing homelessness. So we started doing housing. From that came a need for employment. So we started some businesses and started opportunity to employ people. From those engagements came a need for food security. People were really sharing with us the lack of food security that they had and wanted more food security. And out of those conversations came a desire for better healthcare, for community health, healthcare that was centered in the community with the community at the heart of it. And that was the journey we went on 15 years ago. And we're still on that journey today, but each one of those things I mentioned has a role in community. We are builders of housing and own housing and run a housing first program. We have several businesses, like I mentioned, that employs vulnerable people. We have a food security division that really helps people around food literacy and food access. And then we have a medical clinic, a small little medical clinic that's a community health focused clinic.
Wow. Well, thank you, Murray. A lot has gone in and built up in the last 15 years. And the role of Jasper Place Wellness Centre is an important one. You know, we often talk about the power and importance of collaboration in the community to get things done, to make a real impact. And in the last few months, Jasper Place Wellness Centre, as I understand, has been working in collaboration with another organization to deliver services that weren't previously available to the clients you serve. Can you tell me a little bit more about that collaboration?
Yes, we started talking with Reg at Health Cities several months ago and with many members of his staff about our community health clinic and how we could serve our community better and how we could get better health outcomes. And one of the things I just shared with Reg and his staff, basically off the hand, was just, we're having trouble getting people to go to a lab to get lab results and get tested. And I was sharing what a difficulty it was for some people, especially in poverty, or people that were homeless, or a single mom with 3 kids getting on a bus to go to a lab, or some that just didn't trust the system. And, we found running a community health center that many of the people we deal with have very complex health issues. And it's part of the reason that they haven't been dealt with because of their distrust of the system. So we told Reg that story and his staff, and they came back to us a little later and said, we've been talking to Dyna Life and maybe we could get you a centrifuge. And I said, okay, I'm not being a clinician myself. I didn't really know the value of having a centrifuge. So I had to get them to explain, well, why would we want a centrifuge? So they explained to us that if we were to draw blood on site, they could spin that blood our staff could spin that blood in the centrifuge and then have that picked up by Dyna Life in a safer way. And we said, yeah, let's do that. So, Dyna Life donated a centrifuge to our clinic. Amazing. And we were able to then have the draw blood and urine samples from people and have it picked up daily. And that has had a huge impact on our clinic and a huge impact on the people that we serve.
Well, and I think it goes back to what you said earlier in our conversation. It's the barriers and reducing those barriers to actually be able to deliver services to the clients directly. So well done on the program. And I know it's been in place for, a few months. Did you have any initial goals when you started it?
Our goal was to remove that barrier, to take away that barrier of getting to a lab. so that we could then get blood test results and effectively come up with a healthcare plan for people that really worked in their lives. I can share a story with you where we had an individual that absolutely for years refused to go get a lab test. And we're at our wits' end about how do we serve this individual if we can't get proper diagnostics? And, once we had the centrifuge in place, we proposed that we would draw blood from him. He didn't want us to do it at first either. But through our relationship and through that trust and through collaboration and conversation, he finally allowed us to draw his blood. And once we were able to do that, we had a lot of ideas around what his healthcare issues were, and they were just guesses at that point, but then we had the real data. So it was just so incredible to see that barrier removed and how that person's healthcare dealt with in a much more effective way.
Right. So now a more holistic approach. So as you said before, you suspected, or the team suspected, that the individual might need certain care, but you didn't have the data. And now being able to close the gap, if you will, reduce the barriers, reduce the time to treatment options, because there was an established trust there. And again, as you said, didn't happen overnight, but over time, people are more open to it. Do you consider this to be a pilot program, Murray? I mean, I know it's been around for a few months, and I don't believe that there's a program of its kind, but do you consider it to be a pilot?
Yes, we do. Definitely. There's a lot of learnings that needs to go into this. When we first had the centrifuge delivered, nobody knew how to use it. So, we had to have Dynalife staff come and train us. Then we realized we didn't really have effective policies on the use of drawing blood and urine, and we needed to develop policies around that because we didn't have that in our mandate before as a clinic. So there's been a lot of learnings and a lot of challenges along the way to make sure it worked and that we were effective in doing it and doing it correctly. So at this point, it's still a pilot project. I mean, we have lots of constraints as a small clinic in a trailer in a back alley of the city that makes it very difficult to grow this program, right? So, but, we want to definitely learn from it, and we definitely want to see how we can use it more effectively with more of our patients.
Absolutely. It sounds like the program itself not only demonstrated an ability to reduce the barriers, as we keep talking about, amongst the clients that you serve, but you're actually seeing better health outcomes, even in a pilot study or a pilot program like this. Would that be a fair assessment?
Absolutely. We are definitely seeing great outcomes from this and being able to come up with better healthcare plans for people. And we are seeing people's lives, health in their lives being improved by a very simple thing as a centrifuge in a clinic.
Right. And as you said before, we recognize it's been a few months. So the program is very much in its infancy. And you touched on it a little bit, the plans or maybe the challenges in expanding what this model could be and how many clients you could serve. Can you touch on that for me?
Yeah, there's, an HR component goes around this training, being able to draw blood effectively and properly, having the staff on hand when you need to do it, having doctors that understand that it's on site and maybe they have to be more involved. So there's challenges around this program that you don't know until you try it. And definitely we would love to see it grow and expand. But first we need to really get very good at it and very experienced at it so we can share that data with others.
Right. No, I completely understand. And, honestly, it sounds like you're maybe a victim of your own success here. So, Murray, I guess the next obvious question would be, if you had an ask of the community, of the people listening or watching in, what would that be?
As I mentioned earlier, we're a very small clinic doing community health in a trailer in a back alley in the city, in west end of the city of Edmonton. So there's some challenges around just our physical footprint. Staffing is a challenge as well, because we are a not-for-profit clinic running not-for-profit services. So I would encourage people to go to our website and maybe learn a little bit more with us. We talked earlier about conversations and how important conversations are. And please engage us in a conversation. Come, maybe take a tour, and ask us some questions and let's have a conversation. We do a lot of different stuff, like I mentioned, housing and food security and employment. So the clinic's not the only thing we do. We do a lot of community development. Right next door to the clinic is our drop-in center and our community center. We engage people in support and in services. So, let's have a conversation and coming down and check us out and see what we do.
So clearly a lot has happened in the 15 years. It started with a conversation. And as I always say, conversation really is almost the magic sauce, if you will. As we start to wrap things up, I just want to repeat the ask that you just shared, Murray. For those that are watching or listening, if you're an organization that wants to learn more about Jasper Place Wellness Centre and how you can get involved, I encourage you to reach out to Murray and his team. Clearly in the few minutes we spent together, this project demonstrates another powerful example of collaboration and the strength of community to have real impact on equity deserving populations. Continued success, Murray, to you and your team. I want to thank you again for joining me.
Thank you so much for having me.
Absolutely. And to anyone, again, wishing to connect with Jasper Place Wellness Centre, I encourage you to visit www.jpwc.ca.